everyone. We're going to give it a few more seconds while people are joining, and then we'll go ahead and get started. All right. So hello, everyone, and thanks for joining us today for our webinar, Introducing IMO Precision Sets. Before we get started, I'm going to go ahead and take care of a few items for those attending. First off, this webinar is being recorded and will be available to you for future viewing. Please note that anytime during this discussion, you'll have an opportunity to submit your questions to Mamtha. And to do so, just type it into the question section on your control panel at the bottom of your screen. Today, we are joined by Mamtha Mishra. She is our product manager for IMO Precision Sets here at IMO. If anyone has any questions, remember to put it into the question section, and we're going to go ahead and get started.
Thank you, Jordan. Hello, everyone. Welcome to the launch of the IMO Precision Sets offering. I'm Mamtha Mishra. I am a group product manager here at IMO, and I'm responsible for the IMO Precision Sets product. Before joining IMO, I've been here for around a year and a half now. Before joining IMO, I was with Health and Life Science vertical of SAS Institute, and before that, I used to work for Allscripts. I was responsible for their radiology information system within their Sunrise platform. So let's start with talking about what IMO does, what we are best at. For over 30 years, IMO has powered data capture at the point of care with comprehensive clinical terminology and code mappings that allow clinicians to document in their own words, while ensuring that the necessary clinical detail and billing codes are captured correctly. IMO terminology is integrated into clinical workflows of all major EHR vendors, reaching 70% of the US hospitals. Through these partnerships and integrations, more than 740,000 physicians, or roughly 89% of US physicians and clinicians, access IMO solutions on a daily basis. We deliver the industry-leading foundation of clinically vetted terminology that is always current and meticulously mapped to the right codes. We are experts in the words and codes that describe patient conditions and treatments. We manage over 5 million terms across the diagnosis, procedure, labs, and medication domains, and mappings to all major code systems across the globe. IMO's team of expert clinical terminologists monitor and maintain terms and codes to keep up with all regulatory coding systems, allowing our clients to confidently meet changing regulatory reporting requirements. Okay, so with that background on IMO, let's talk about the offerings within the IMO data quality management solutions. These solutions extract, enrich, and structure clinical patient data across the healthcare ecosystem, making data more complete, consistent, accurate, and usable. So IMO recently acquired Tech, a data analytics and business intelligence company that empowers the healthcare and life science industries to use artificial intelligence and natural language processing technology to extract information from biomedical textual data to solve real-world problems. This acquisition will enhance IMO's portfolio of healthcare data quality solutions and enable IMO to expand its offerings across market segments to tackle diverse problems like improving clinical workflows, administrative workflows, outcomes, and clinical research. IMO Precision Normalize solution normalizes and adds standardized codes to data from multiple sources. Tech NLP provides natural language processing capabilities, and IMO Precision Sets simplifies the process to define and manage clinically consistent patient profiles and value sets. Accurate patient cohort identification is of paramount importance in healthcare. A patient cohort is a group of individuals who share specific characteristics or conditions and are targeted for analysis or intervention. Accurate patient identification ensures that the right patients are included in each cohort, enabling precise data analysis and improving patient care. So what is a value set? The accuracy of a patient cohort will depend on the specificity of the codes used to identify the diagnosis, procedures, lab, or medications. The roll-up of these complex and nuanced terms into clinically accurate grouping is termed as value set. They also go by other names like code groups, code sets, or groupers. Value sets drive a variety of analytics or decision support needs that an institution may have. So here are some examples of these use cases, but I'm sure there are many more use cases for value sets in the industry. For population health, public health, and patient registries, value sets have a significant impact by enabling precise identification and stratification of patient populations, improving targeted interventions and healthcare planning. In clinical decision support, value sets play a crucial role in providing clinical guidance and alerts at the point of care, empowering healthcare professionals to make informed decisions and deliver personalized evidence-based treatment. Next, within interoperability and meaningful use, value sets are essential for interoperability in healthcare systems, ensuring standardized terminologies and coding systems are used consistently, facilitating data exchange and promoting better communication between healthcare entities. Next, on to quality reporting and improvement. Value sets define the clinical measures and criteria to assess performance and progress, helping healthcare organizations identify areas for improvement and implement targeted interventions for better patient care. For insurance companies, value sets streamline claim processing, assess risk accurately, and engage members effectively by enabling standardized coding and terminology use, leading to more efficient and accurate data analysis and decision making. And lastly, in clinical trials, value sets are crucial for precisely defining the patient cohorts and study criteria, facilitating the recruitment process and ensuring that the trial results are reliable and applicable to the target population. Okay, so it's now time for a poll question.
Mamta, all right, if everyone could direct their attention to the screen, what is your role in the value set curation process? You can select all the apply. So is it I kindly request a value set and or patient cohorts, I create/author the value sets and or support their maintenance. I'm not responsible, but manage a team that creates and maintains value sets. I help integrate value sets into other systems for downstream use cases, or I am in a clinical role and have clinical background and support review and approval. I'll give it a few more seconds while people are answering, and then we can move on. Okay. So it looks like a majority, it looks like 50% kind of help integrate value sets. And then also author value sets too. Okay.
Thank you so much for those responses. So now continuing on. So in our conversations with several users who are involved with creation and maintenance of value sets, we identified 3 common challenges with the workflows. First one was authoring a value set accurately to the right level of specificity is complex. It takes a lot of collaboration between data analysts and clinicians to get it right. The lack of common processes and best practices across teams and departments further complicates the situation. The collaboration takes a lot of back and forth and hence a longer turnaround time to put together a value set. And finally, constant code set updates result in outdated value sets. Without proper tools, processes, and governance, maintenance becomes a burden. Often, users prefer to create a value set from scratch when requested rather than maintain a repository. So this slide provides some statistics that highlight the cost of poor data and the data maintenance burden. In advance of HIMSS 2023, IMO conducted an in-depth survey to take the pulse on data quality issues and technology challenges faced by the US healthcare sector. The survey participants included leaders who are responsible for purchasing and implementing technology at healthcare provider organizations. So around 45% of the participants said that data-related challenges like management, fragmentation, and optimization was one of their top threats. A shocking 90% of provider leaders admitted to situations where they had lost or leaked revenue due to inefficient data use. Based on this, it is no surprise that 63% of the respondents said that they plan to invest in robust data management software solutions. As indicated on the bottom of the slide, we also try to get an average count of impacted codes within every code system update over the last 5 years. These updates may seem insignificant, but their cumulative effect on data maintenance work can be substantial, leading to increased costs, compliance challenges, and resource strain for healthcare organizations. So let's take a look at a typical value set creation workflow. This is what we heard from most of the users that we interviewed. The request for a value set or a patient cohort typically is received via an email or a request tracking tool. The data analyst then uses code system lookup tools or websites to query potential descriptions that match the request to compile a list of codes. After several such requests, they end up with multiple Excel spreadsheets, and then they try to consolidate these spreadsheets to come up with one long list of codes that qualify for the request. So this is a very manual step, and they have a draft version of the value set at the end of it. So once they have the draft, they share it with a clinician for feedback, either via email or collaboration platform like SharePoint. The data analyst then reworks the value set over multiple iterations to apply feedback received by the clinician to generate the final version. Over a period of time and multiple code system releases, these value sets become outdated, and it requires a similar manual approach to refresh them. As you can see, this process is very manual, time-consuming, it's error-prone, lacks standardization, and hampers collaboration and governance. Time for another poll question.
Thanks, Mamta. All right, everyone direct their attention to the screen. So what are your challenges related to creating and maintaining value sets? You can select all that apply. Is it value set data accuracy or clinical complexity, tools and resources, value set standardization across teams and departments or sites? And then is it ongoing value set maintenance after code systems were updated or released? Just giving it a few more seconds while people respond. Okay. Now it looks like there's a lot of ongoing value set maintenance and then also value set data accuracy or complexity. Okay, back to you, Mamta.
Thank you, Jordan. That poll response validates what we have heard across the interviews that we did around 6 months ago. So thank you for that response. So the shortcomings that we discussed above underscores a critical need for a better alternative that streamlines the value set creation process, ensures accuracy and standardization, saves valuable time and resources. Let's find out how our IMO Precision Sets can be a catalyst for addressing these challenges. The vision of IMO Precision Sets offering is simple. We just want to simplify the identification of reliable patient cohorts by streamlining the value set creation and maintenance workflows. So time for a live demo of the tool. Let me bring up our tool in front of you. So this is the IMO Studio. This is a one-stop shop or a one portal where customers can log in to access any content or tools that they have licensed from IMO. So you see Precision Sets on the left-hand side here. What you see now is the value set library. So this is the one repository approach that I was talking about. You see that the value sets here are grouped by industry standard value sets, IMO curated value set libraries, and then a custom library. So we want this portal to be a one-stop access for all value set needs for our customers. So there are several industry standard value sets that you may use within your workflows. We download value sets from websites like NCQA and VSAC and make those available here. We keep them up to date. As soon as a updated version is available, we make sure we update our industry standard value sets within IMO Precision Sets. And then we have the IMO library, which contains value sets that are curated by our IMO clinicians, and they are kept up to date with every code system release. And any point in time that you access it, it's up to date. Finally, we have our custom library. So any value set that the customer authors from scratch or makes a copy of the industry standard value set or IMO curated value set and customizes it to match their request, or imports, the customers may have existing value sets that they are managing today, either in a spreadsheet or in some kind of a relational database or some other mechanism. So all of those can be easily brought into a Excel template that we provide and imported into this tool. That way all value sets are available in one place. So now within this value set library, when a request for a value set or a cohort comes in, a user or a data analyst can come in and easily search for a value set. System will search across industry standard source, IMO library, custom library, and surface all the value sets that meet the search criteria. So once I have my search results, I can then expand one of the value sets to see the scope inclusion exclusion. If it matches my request, all you have to do is download this value set and use it within your downstream workflow. So let's say it's closed, but not exactly what the request entails. You can easily click on the view button to load this value set in the value set editor and look at the rules and the output codes. So note that here we have multiple versions. Like I said, as the code system updates come through, we provide the version, and every time a user makes a modification and publishes the value set to the repository, we create a brand new version. So the tool also allows you to compare two versions side by side to see which codes were removed or which codes were added, and gives you a way to consolidate if needed. You can also select a previous version and easily make a copy of it to create a variation of the value set and add it to your custom library. So let's say this value set is closed but does not meet the request that I received. Just with a click of a button, I can copy this industry standard value set or a IMO curated value set, or one of the value sets that you may have authored from scratch for your organization, and make a copy of it. I need to provide a unique name. So let's just go provide a name here. You can update the scope inclusion and exclusion criteria, look at the rules, and make any modifications that you need to make here, change the map type, and then you can save it to the repository to create a variation of the value set. So this is how you copy. I'll get into more details of each of these steps. Let's now go into creating one from scratch, which will give us a good understanding of how this tool works. Okay, so now I'm trying to create a value set from the scratch. So let's say the request came in for diabetes value set, and the exclusion says that I don't need gestational diabetes codes within that value set. So I can search for codes here, provide a name for the value set, provide the scope inclusion exclusion. With our, I mentioned to you the Milax Tech acquisition. With that, in the future, we'll be introducing some NLP capabilities here, just to envision how that will look like. When you get a request for a value set, you can copy the scope inclusion exclusion into these text boxes, and system will use the NLP capability to come up with the first set of rules and output codes. You can review those. If that meets your needs, just save the value set, you're all done. If not, you can review the rules and make modifications to create a value set. So I've searched for diabetes mellitus and I have a bunch of results here. So let me click on the description of the code. It displays in a hierarchical view all the parent codes for diabetes mellitus disorder and then the child codes for the specific code. Now, it's totally up to the author to say, okay, I want to include diabetes mellitus with all the children. The system allows you to navigate to the lowest code. It can go multiple levels. And when you use the map type include with children, all the codes to the lowest level will be included within the value set. And then I can go to one of the child codes, which is diabetes mellitus during pregnancy, childbirth, and I can exclude this with all the children. So now I have very easily achieved, I want a diabetes value set and exclude any pregnancy-related diabetes codes from that particular value set. I can add other codes too. I can navigate to the parent and determine, okay, are there any other codes that I want to add to the value set? I could even just include one of the codes if you think that's there in your source data. And as you add rules, you could even preview all the rules that you've added and make modifications if you need to as you're authoring. Once I'm done with this, go back to the value set editor tool and you have a rules tab which displays all the rules that you've added so far. We can update the rules here or even delete a rule. I'm going to keep it simple for the sake of this demo and just keep one code to show what we are able to do with the underlying IMO capability where we are using the mapping functionality. So now I've selected this code. I just have one rule for my value set. I'm going to save draft. The moment I save draft, the application is going to evaluate all the rules added to the value set and bring back the output codes. And notice how the output codes not only shows you the SNOMED code that you added, but it also, using the IMO mapping, brings back IMO lexicals, ICD-10 codes, ICD-9 codes. I'm building a value set in the problem domain. So those are the code systems that we are supporting right now. We plan to expand in the future, but that's what it is. As an author, if you don't really care about IMO lexicals and let's say ICD-9 codes, you can exclude that from your output view and just save this value set to your repository. Let's say you excluded ICD-9, but later on you find out that ICD-9 codes are still being used. You want to include that. It's as easy as coming to this view and just including ICD-9 codes in your output. Once you're done with this, notice how you have a download button. You can very easily download this value set to use within your downstream applications. You can save it and make sure it is available to all the users within your organization. I'll show you how it shows within your repository in a bit. After I have edited this, I may have to go through this multiple times. I may have to request a clinician to validate if I've built this value set correctly. They'll have the same view so they can follow along as you review it. I can publish this value set and create a version. So I'm building governance there. Notice how the system is tracking who was the user who created it, when did they create it, when was the last it was updated, who was the user who updated it. There's also source info, which will tell you, was this value set authored from scratch, or did someone make a copy of the industry standard value set or IMO curated value set and then make modification to it? You'll have the information there so you can trace back to the source of this value set. Or let's say you used the import template and you already had these value set built out before you started using IMO value set editor. The source information will also let you know if it was an imported value set, give you the external ID. That way you can go back to your previous system and look it up if you need to. So now that we have seen how the rules and the output work, I showed you earlier that, every time I publish a value set, I create multiple versions. I can do a side-by-side comparison of those versions to see what the differences are. Apart from this, I mentioned to you the maintenance capability. So let's say there was a SNOMED 2023 release that was applied recently, next time I log into this tool, system will notify the user that, hey, there was a recent SNOMED 2023 update that happened. Based on that, let's say you have 100 value sets in your repository, system will notify and say, maybe 20 value sets out of the 100 were impacted. When you click on that notification, it'll list all those 20 value sets for you. And when you click into the value set, it'll list all the codes that are impacted. It could be codes that were recently retired or codes that moved hierarchy. So with that visualization of the impacted codes, you can easily take action. Like I showed you, maybe you want to change the map type or delete that code completely from your value set. And then you can finalize it to create a new version, put in a comment and say, I have reviewed and finalized for the recent 2023 SNOMED update. It's as simple as that. So going back to value set library, I just want to show you that the value set that I authored just now is now available to you within the custom library, and any user within the organization can access this value set, download it, and use it within their workflows. Okay. Yeah, we have to do the manage value set import. So I talked about this. We provide a template which makes it easy for you to pull in all the value sets that you may have currently have created. Notice how, we just have a few columns here. Value set name, since this has to be unique. External value set ID. This is to give you traceability. That's the only reason this is captured and persisted within the new tool. Value set ID, this is a unique ID that the system generates for every value set that you import. Scope, inclusion, exclusion. Here you see that the scope, inclusion, exclusion is repeated for every row, but it's totally a user preference. If you, if you're manually filling this template, you can just fill it for the first row and leave the subsequent rows blank. Or if you're writing a query on your relational database to pull in this information, maybe your query returns scope, inclusion, exclusion for every row, and that's supported too. And then we have the code system and the code. So let's pull this into the system and see how it works. So I just have to drag and drop my file. The file is first uploaded into the tool. In this case, it's telling me there is some errors within the file, and hence it's not able to process it. Once it uploads successfully, it will process through the file and create the value sets based on the data that is there in the file, and then provide you links to access those value sets. So if I click on the link, it will take me to the value set editor tool where you can see the rules and the output. These are value sets that you were externally managing. Now it's available for you to maintain within the value set editor tool. Going back here, if there are errors when processing the file, those will be listed too. And the errors are include information where you can go back and fix those and reprocess the file to create these value sets. For instance, here it says, okay, the value set, one of the columns is missing, or in some cases, probably to say the title already exists, it has to be unique. So it's as simple as that. Drag and drop your file in here, and then it processes and creates your value sets for you. Okay, so I think that's what I wanted to cover about within the solution itself. Let's go back to our presentation. Just like you saw, IMO Precision Sets attempts to address the previously described challenges by providing a tool for you to build precise value sets with accurate codes, improves collaboration by providing a consistent view to everyone, be it the data analyst or the clinician. Everyone gets the same view, and they can collaborate to build and finalize this value set. And finally, it kind of simplifies the entire value set curation workflow or the process. So in the fast-paced world of healthcare, IMO Precision Sets stands as a game-changing solution, empowering organizations with unparalleled benefits. It ensures that value set data remains current and clinically valid, reducing the false positives or negatives and supporting informed clinical decision-making process. The ability to easily and efficiently create a new value set is remarkable. It saves time for clinicians, analysts, and maybe also healthcare IT personnel while minimizing the cost to maintain data. It also maximizes the functionality of the existing HIT infrastructure for a greater return on investment. So we're working with a few development partners and early adopters, and we kind of got some feedback from them, testimonials from them that we wanted to share with you here. So this feedback was provided when our development partner users were testing the ability to import their existing value sets, which had been manually created into the IMO value set repository. So while working with Excel files and trying to collate data into the Excel files, I'm sure many of us have seen how difficult it is to maintain the integrity of the data. So our research and interviews indicate that file formatting it's a major headache. Value sets created in-house and pulled in from multiple other sources typically have data organized and presented in different ways. This results in a significant amount of reformatting and tinkering to make it consistent. We've made it as easy as possible to upload all your value sets into IMO Precision Sets without any formatting challenges or fear of losing information during the import. So this is another early adopter partner that we are working with, and I just wanted to share the testimonial he provided with you all.
Hi, I'm Dan Exley, Vice President of Clinical Systems at Sharp Healthcare in San Diego. I'll take a moment to share with you how my teams have been using the Precision Sets tool from IMO to enable access to and interaction with industry standard value sets, and to easily create custom value sets that are based on or completely independent of those industry standard value sets. My team's now able to start a conversation about what are the terms that we should use, what are the groups of codes that we should use in order to build a report, build a dashboard, build a list in new ways. The folks that they're talking with in operations, their colleagues over there have never heard of the Value Set Authority Center. They're not informaticists, they're not terminologists, but the Precision Sets tool gives us a simple interface which allows analysts on my team to engage in conversations with their colleagues throughout the organizations about those industry standard terminology sets that are critical component to how we define the way that we look at the data in our organization. The Value Set Authority Center has been out there for a long time. Organizations in general haven't been leveraging what's there except for maybe the limited ways that they had been required to for a certain external reporting requirement. And in some cases, organizations do have terminologists and more advanced ways of interacting with industry standard terminology sets. Many organizations don't have the staffing model, haven't had those imperatives. The further we go with standards-based interoperability, the more important that it will be for us to all be using these industry-based ontologies throughout the common reporting tools and EMR configurations and data warehouses that we have out there. The Precision Set tool makes it easy for our team to interact with those, and for us to also create custom value sets, either based on an industry value set, but modifying a little bit for a local use case requirement, or creating a completely new value set using that same framework, which allows us to commonly review it, govern it, and make it available to other parts of the organization. I really like the single click to export a value set into an Epic import spec ready to go format. That file can then be loaded up and create a group or record into Epic so that a person who's building a reporting workbench report or cascading down the line into Claire or Canoodle would have those value sets available. I think it's a game changer, really unlocking the power that was previously only possible if you had a sizable team of terminologists and informaticists working to make this stuff available. The machine's doing that work now and empowering more and more members of my team to be able to operate at a higher level than they were previously. It's exciting to see how we're bringing forward work that's being done across the industry into our organization in an easy-to-use way, and I think there's much more to come. I'm looking forward to being able to use the APIs to engage this and reveal it to other software components of our stack, out into our data warehouse, just as we have with the IMO Precision Normalize tool over the last couple of years. So it's exciting times. I'm glad IMO is taking up the call to provide meaningful tools that extend and expand the capabilities of our teams in ways that previously just weren't possible or manageable. If you'll take a look at it, there's a lot to be learned and value that can be driven from using the tool. So check out Precision Sets for IMO. Hi.
So, to summarize, IMO Precision Sets attempts to streamline value set creation, curation, and maintenance workflows. With prepackaged value sets and a new editing and maintenance tool, organizations can produce accurate code groups at scale for better patient cohorts, clearer insights, and compliant reporting. I think that wraps up our presentation today. Jordan, on to you for Q&A.
All right, thanks, Mamta. Yeah, so at this time, we'll kick off our live Q&A. So any questions that you heard that you want to address, type them into the Q&A box, and we will begin answering them live. Just note, please excuse any brief silence for us to review and answer. So Mamta, one did come in that's saying, how would the value sets be assessed by our Power BI reports or by the SSRS reports?
So like I showed you during the demonstration, after you have curated a value set, you can download it. Today, what we support is downloading to Excel file, a text file, a Epic VCG compliant file, because Epic provides some scripts that can be used to pull these value sets into your grouper editor or slicer dicer and be used within the Epic system. So that's what is available today. But then on our roadmap, we also want to provide connectors and APIs. That way integration with other downstream systems can be made more seamless and cut out on this export and import into downstream system workflow. So in this case, I think you should be able to utilize those capabilities to quickly get your get the value set information into Power BI or SSRS reports.
Another one came in. If you provide HEDIS value sets, will the customer need to have, am I saying it, HEDIS licensing, or does IMO take care of this? Also for CPT.
Yeah, so the way it works is you can work with IMO if you don't already have a HEDIS licensing. During we'll have conversations about that, and IMO can get you that license. That way you just have to have one negotiation and everything will be included in the same package.
Okay, great. Another question is, do I need other IMO products to get and use IMO Precision Sets?
Yeah, I actually see another question. I think it answers both of those. Is there a separate cost for the terminologies used? No, the way we have designed and packaged IMO Precision Sets is that, you're just paying for IMO Precision Sets. Everything else is included in the price.
What code systems are supported within this tool?
So for the first release, we are targeting within the problem domain ICD-10 CM codes. You saw that in the demo, SNOMED codes, ICD-9 CM codes, and IMO lexicals. Within the procedure domain, we'll have CPT, ICD-10 PCS, Law Inc., and then again IMO lexicals, and that covers both procedure and lab. Within medication, we are targeting RX norm and NDC, but that's just a initial phase of this product. We do want to expand to other core systems also in the future.
Great. And then does IMO have risk adjustment value sets?
We can, there are some industry standard value sets that we download from VSAC and include, and then there are some IMO curated which can be utilized for these workflows as well. However, if you can give me more information around this, we can talk about it. If you can reach out to us offline and we can discuss this further.
Great. How about allergy related? Like allergens, drug, non-drug, reaction, severity?
Similar answer. And I also see probably Grant wants to chime in on some of these questions. Grant?
Oh, sorry, Mamta. I was just marking those as ones that you had gone ahead and answered. Sorry about that.
Sorry. Same answer for this question too. We do have some value sets already available. If you want to reach out to us, we can review that list and see what works for you. If you have additional needs, we can definitely discuss that further.
Great. One more question so far. So how does IMO manage the terminology releases? Also, can you keep several versions of a terminology at once in the tool?
I think IMO does that. Do we support multiple versions of terminology within IMO Precision Sets? Well, it's on my roadmap. Right now, it's only the current version that we use to author the value sets. But in the future, IMO does maintain older versions of the terminology also. We do want to expand our functionality to consume those older versions and give you the capability to author value set based on those older versions of the code systems.
Awesome. All right, so it looks like that's the questions that came in. Thank you, Mamta, and thank you so much, everyone, for attending. And we hope you found everything useful today. So if you have any questions or want to learn more about IMO Precision Sets, please email your client executive, or you can email sales@imohealth.com. And then you can also visit us on our website at imohealth.com. Thanks so much for attending again, and I hope you all have a great rest of your day.
Thank you.